The World Health Organization is warning of a third wave of coronavirus in parts of Africa. The continent has done relatively well compared to other regions, but are countries doing enough to stop new infections? This is Inside Story. Hello, welcome to the program. I'm Rob Matheson. When the global pandemic began more than a year ago, many predicted African countries would suffer devastating losses. There have been more than 5 million cases and nearly 140,000 deaths on the continent, but that only represents less than 3% of the total global COVID-19 cases, and a fraction of the continent's 1.3 billion people. But there have been worrying signs in recent weeks, with more contagious variants driving up infections in many African countries. Cases in some regions have more than doubled just in the past week. The number of deaths has gone up as well. Leaders in Africa are now urgently appealing for more vaccines. Fewer than 1 in 100 Africans are estimated to have been vaccinated. The WHO warns the situation could get worse if vaccines are delayed further.
In Africa, cases have increased by 52% just in the past week, and deaths have increased by 32%. And we expect things to only get worse. Less than 1% of Africa's population has been vaccinated. Vaccines donated next year will be far too late for those who are dying today, or being infected today, or at risk today.
Well, the G7 has pledged to commit 1 billion vaccines to developing countries. The EU will donate 1 million jabs, while the US is to provide 80 million. But African health officials say more is needed. The director of Africa's top health agency is calling for a concerted effort to tackle the crisis.
The third wave is here, it's a reality. As I said earlier, 15 countries across our African Union member states are now experiencing that, and we anticipate that more countries will be in that logic. For how long it will take for us to peak, we don't know. It all depends on our behavior and collective actions that public health measures that will be taken.
South Africa, Tunisia, Zambia, Uganda and Namibia account for nearly 80% of the recent rise in new infections. South Africa is the worst hit nation. It's just tightened its coronavirus restrictions. Hospitals in Uganda have reported a severe shortage of oxygen, and they're no longer able to admit patients to intensive care. At least 7 other African countries have run out of vaccines, and 7 more have used 80% of their stocks. The WHO says more contagious variants have been detected in nearly 39 countries. Okay, let's bring in our guests. In Brazzaville, Tiano Baldi, he's Deputy Incident Manager for COVID-19 Emergency Response at the World Health Organization Africa. In Oxford, we have Moga Kamalyani. She's Senior Policy Advisor at People's Vaccine Coalition. And in Rabat, we have Azzeddine Ibrahimi. He's Professor of Medical Biotechnology at Mohammed V University. Welcome to you all. Tiano, I want to ask you first, because you're in Brazzaville. What is causing this third wave in African countries?
Thank you, and good afternoon. Thank you for the opportunity. I think there are several factors. The first one, currently we are seeing this increasing number of cases in countries around the southern African countries, around the South Africa, Namibia, and Zambia. And the one explanation is about also the winter season. Currently, this is the winter season in southern African countries. So this is an element which can explain the situation. The second element is also the circulation of different variants of concern, which we are seeing, in many countries, and notably the combination of the Alpha variant, the Beta variant, and also the Delta variant, both in South Africa, in Uganda, in Zambia. And the third point, it can be also this fatigue of the communities, about relaxing on adopting strong public health and social measures, which can help us to protect and to stop the transmission of the chain. And obviously, the fourth point is also the low level of immunity of the population, given the slow rolling out of the vaccination in our region. So in a nutshell, I can say those are the few and main factors explaining the current upsurge of COVID-19 cases that we are seeing in the region in Africa.
The WHO's Regional Director for Africa, Matshidiso Moeti, is quoted as saying, Africa's public health system must be scaled up to find, test, isolate and care for patients. Is that actually possible, given the amount of stress that the system is already under?
Yes, indeed. It's quite very important to really scale up and augment and increase all of the different aspects of this response, starting from the detection of the cases, isolation in a very quick and effective manner. But at the meantime, also augmenting and increasing the level of sensitization and the engagement of the communities. One major point also is about the capacity in terms of treatment, in terms of clinical case management. This is, we have seen really hospitals which are really overwhelming in different countries, and we are trying to provide the necessary technical and financial support, for really having the exact capacities for treating the patients which are currently affected by the COVID-19 cases.
Moghal Kamilyani, the G7 summit has promised 1 billion doses of vaccines. How confident can people in Africa be that they're actually going to get those?
Well, in the G7 and everybody has been talking about nobody's safe until everybody's safe and all that. But we saw that the words were in one direction and the actions and realities are in different directions. So even the 1 billion, when you calculate the donation that was announced, it doesn't reach that figure. And it does include like the money they already donated to COVAX, how many doses it will buy, in addition to the Biden administration announcement of actual donation of Pfizer vaccines. So, and then it talks about it will be available by next year. Well, that's too late, given what we just heard. It's very too late. By now, the US, the UK, but basically the G7 are aiming to reach herd immunity in their countries where over 60% of the populations have been vaccinated. Compare that to 1.5% in Africa. If you take Morocco out of the equation, if you put Morocco in, it's about 2.5. Still in both cases, it's very, very low. So no, they're not addressing the fundamental problem that we have had since last year, that it could have been expected. And the fundamental problem is lack of vials, lack of actual vaccines. The production is not enough. It's a simple fact. WHO estimated that you need 11 billion doses to vaccinate the world. That doesn't take into account booster doses and all the other issues that they talk about here in the G7. So how do you get 11 billion doses? Just by relying on companies' goodwill. We do need, if they're really serious, if the G7 was really serious about vaccinating the world and vaccinating Africa, basically, they should have influenced the pharmaceutical companies to join the WHO technology access pool, where they can share technology and waive intellectual property. So that will enable several companies in developing countries to produce the vaccines. At the moment, these companies cannot do it. The Minister of Health in Indonesia a couple of weeks ago said that companies in Indonesia can produce 500 million doses a year. Well, they can't, because nobody will share the technology with them, and nobody would waive intellectual property. So it's not serious what they talk about. It's kind of donation and relying on the goodwill of pharmaceutical companies. That never happened. Goodwill of pharma.
Forgive me for interrupting, but I want to expand on this. In your opinion, given your background and the study that you've made of this, if the situation for Africa doesn't change from what it is now, how bad is this going to get for Africa?
Well, it's going to be very bad. If the infection is rising and there is no vaccine, there is nothing that will stop the infection. There is nothing spreading around. There's nothing that will stop the virus from mutating and producing different mutations. As we know, the second mutation was in the variant, happened in South Africa, and that wasn't, the AstraZeneca vaccine wasn't highly effective against that particular variant. So that is possible to happen again. And we have variants that are, if you like, resistant to the current vaccines, which would be a problem for everybody. So what the G7 is doing, focusing only on their people, and a bit of donation here and there, is actually short-sighted, even from a purely selfish point of view. It's short-sighted.
Azadine Ibrahimi, the WHO says Africa needs 200 million vaccines to inoculate 10% of the population. But as we've just heard, herd immunity is between, I think, about 60, certainly 70%. Even 200 million vaccines is barely scratching the surface. Is there a way around this? Is there a way that Africa can actually turn this and make it work for itself, unless it gets the technology and the intellectual property rights that it needs?
Well, I couldn't agree with Burga more. I think what's happened right now, besides science and besides manufacturing, I think it's a moral issue here, because here, as humans, we are talking about selfishness, fairness. It's values that really, we see that the virus were more human than humans, actually, because the virus didn't differentiate between the poor countries, didn't look at color of skins, didn't look at your wallet, for example. But for all these countries, I think it was the right direction, a step in the right direction for the G7, but it's really too short, too little, maybe too late. I think that's the main thing about your question, actually, because I think Moderna, for example, said since the beginning it will be waiving its patent, but never gave up their technology. So it's going to be really difficult for these countries to, and the example of Indonesia here, you cannot actually manufacture anything without tech transfer. And I think without this tech transfer, we cannot do it. For Africa, I think it's the only thing that is really maintaining somehow the survival of Africa is the age pyramid, actually. It's a young kind of continent, but I don't think that we can talk about surviving the pandemic based on either what we have as amount of vaccination or the other thing of the health system. The health system of the world, actually, we can see the US, New York, for example, broke up during the pandemic. So I don't think that we can survive any third, first, whatever number you can give it, pandemic surge, because I think it's going to be a disaster. The only thing that is really maintaining this kind of situation is the fact that it's a young continent. What we have to do, actually, I don't want to blame the world for what we are looking or seeing in Africa. We blame ourselves, actually. I think it's something that we have to start with. But one thing that we have to try is to support, actually, the WHO. I think the WHO is a mechanism, is a tool that is very important for African countries to support. The COVAX is very important, the tech transfer. And I think it's really unfair. And I'm just trying not to be angry, actually, when you see a couple of countries talking about vaccinating children because they hit the resistance of the anti-vaxxers. And in Africa, if you take out Morocco, you have less than 1% of the population is vaccinated.
So the rest of the world may be seeing this as an internal problem for Africa, Azadine Ibrahimi, but what would it take for Africa to convince other countries in the world that what happens in Africa actually will affect them seriously?
Well, I think it's quite clear, I think, in their minds. I think they are not just trying, there is a strong lobbying, internal lobbying, but I think you can actually think locally. That's something that there is no problem with it, but you have to see the impacts globally, because we cannot come out of the pandemic without the whole world actually getting a certain amount of immunity. So to convince these people is quite clear. I can just straight to the point. What's going to happen in Africa if we left the virus multiplying, and Morga talked about it, it's going to be a lot of multiplication, a lot of mutation, a new super variant that will be here, and it's going to be catch-22 again, and we can come back to square one. The second thing, it's economical point. So if 1% of the GDP of Africa is going down with the pandemic, you imagine it's going to be 1% of the Americans or the Chinese or the Europeans coming down. So why I think we are in the same boat. And I think this country should think about Africa and come into Africa to fight the pandemic.
Tiana Baldi, Azzedine Ibrahimi there saying that the WHO is key in all of this, in coordinating all of this. And of course, it's part of organising the COVAX system. But the COVAX system at the moment, at least as far as Africa is concerned, doesn't seem to be working very well. There seems to be a disconnect between the WHO and its intentions and its ability to persuade richer countries to actually stump up the vaccines that they say that they will provide. What else can the WHO do to give leverage to these countries and make them do what they promised?
Thank you. I think there are different dimensions into this problem, and that there are a lot of challenges, in terms of the procurement and acquisition of a quite good number of the vaccine for vaccinating all of the people who are in needs in the region here. So this is clear. I think there's no doubt around that issue. And I do think there are different efforts which are being made, for the time being, for getting more vaccines. Obviously, we are not there yet. However, in addition, I think if we have a look at these problems more holistically, there are also many other things which can be done also, for at least, halting or at least slowing down the transmission. That's what I was saying. As a normative organization, the WHO, the vaccination is one tool, but a part of that pillar, a part of that tool, we have also other means on which we are also trying really to increase and to scale up. Again, it has the limitation. It's about really improving the case management, the clinical case management, the isolation of the people, the tracing, the contact of the people. We've been in this pandemic for more than 1 year and a half. And we know what were, the expectations. We were thinking that Africa will have, collapse totally, but we are still here, 1 year and a half ago. So there are many things that we can do. Africa is also a continent. It's a group of countries, which has their own reality. We have some countries today where, the vaccination is quite well advanced, in others not. But how can we really look at our possibilities locally? Obviously, with the support of the global community, for really tackling this problem. And this is what at the WHO we are doing currently for Uganda, for DRC, trying really to monitor the situation, providing the technical support, training people, and giving them some oxygen, because people, need those type of tools also, oxygen cylinders, to be able to treat patients, correctly. And the decentralization also of the treatment at the district level. And one advantage that we have is the related lethal connectiveness, that we have in the region here. So the movement of the people. When we saw last time with the volcano which has erupted in Nyiragongo in the DRC, we saw an increase in number of cases, in Rwanda. But this is not happening that often. So we really need to have this view holistically, for sure, to try to get maximum of vaccine, but at the meantime also upscaling all other areas of work where we can make a difference. This is what I can say for the time being. Thank you.
Professor Ibrahimi, let me ask you about the state of the effectiveness of some of the vaccines, because the suggestion is that the rollout could be, well, the WHO is asking for 200 million vaccines. We've already discussed the effectiveness of that particular figure. But what about the actual vaccines itself? Because it occurs to me that we know that one vaccine isn't enough. It requires two, which automatically limits the number of people who can get the vaccine. But of course, also, timing is a factor in this, because vaccines do expire. And that is putting additional pressure on all of this delivery system.
Well, I think we have to agree. And I think to come back to the story of bringing up and developing this vaccine, it was a human success, actually, that we were able, actually, with more than 5-6 vaccines, that's quite effective and sure, and to have them, it's great, actually. And I think I have no problem with them, actually, that they will be not efficient. I think all the vaccines right now, the Chinese, the Americans, the British, whatever vaccine you are using, it's fine. And we can see that everywhere we get a certain point of our percentage of vaccination, the numbers of infected people are lower, the deaths are lower, and I think it's great that we are having the vaccine. The only problem, as Murga told you before, actually, is just we don't get enough doses. I think that's the main problem. And the other thing that you said, Robert, is true, is the fact that we are using 2 doses to get to immunity. And I think that's hamper actually the effort of vaccination. But right now, I'm just thinking about Africa. Every vaccine that we can get to Africa will be good. And it's not good just for African countries. I think it's good for whole world to bring up these vaccines to Africa. The other thing that we have to make sure and to keep in mind that this pandemic will stay with us for at least 2 other years. So it's still possible actually to build up capacity and capabilities in Africa to be able actually to produce and manufacture vaccine. And that's something that should be good to be done, not just for Africans, and they have to insist on that. It's not, I mean, even if you are in a rich country, don't think that you are out of the woods because you vaccinated 60%. It's not true, because if you have a super variant in Africa, it will come back to haunt you and bite you if you don't fight with us.
Olga Kamayani, while we are waiting for that technology and hopefully that intellectual property to be developed in Africa, if it happens, how big is the risk, do you think, that if the virus continues unchecked at the rate that it appears to be going at the moment, Africa, or at least parts of it, could end up being locked off from the rest of the world in the same way that we're seeing countries closing their borders to other countries in the Northern Hemisphere?
Well, that's a danger. That's what's happening. Now you can travel within Europe with a passport. The same will happen between Europe and America, between Europe and all the rich countries, and they will just exclude Africa and other poor countries, except if you have been vaccinated by a vaccine that's recognized in the north, if you like, or in the west. So they will be creating even further inequality, even within the African countries, between those who are vaccinated with their vaccines and those who are not vaccinated or who are vaccinated by something else. And that's creating even more problems for Africa. So just saying a bit of donating to COVAX is going to solve the problem. No, they're not going to solve the problem. They're actually going to cause more problems for Africa. And let's not forget, when we talk about the economic issue, talking about the macroeconomics, like the country's economic, but you're also talking about the livelihood of people. Yes, in the West here, I live in Britain, so social distancing and self-isolation, all that is possible for the majority of people, while in Africa it's not possible, because I would have had to go out and earn money, sell something or do some service to bring food to my kids. So this thing of the preventive measures are very difficult to implement. So the solution for Africa is massive vaccination, and that's what should be the interest and the actions by all countries, rich and poor.
I'm going to interrupt there because I want to ask Tiano, but I'm going to ask Tiano Baldi just on that point, actually, because of course the WHO is at the forefront of trying to manage this situation in Africa. Having heard everything that our guests have been saying, to my mind, the picture looks pretty bleak. It doesn't look as though these vaccinations, these extra vaccinations, are coming anytime soon. Your teams are on the ground. They're having to deal with this immediately. How is this making you feel as somebody who is trying to cope with this situation?
Yes, it's not very easy. Definitely, we have to admit it. But also, there are some. This is not somehow the first major outbreak that we've been facing in the region here. Definitely, it's different ones. We just ended the Ebola outbreak in Guinea. Other outbreaks also, in the DRC. For sure, we will really like to have more vaccine, to vaccinate this population in the region here. However, what can we do now given this situation? And what can we do now given this situation is really to put all of our efforts collectively, to try to make things scientifically, doing surveillance and helping people, to get treated and encouraging people to stay at home. It's not easy, but we went through during the past 1 year and a half, and I do think like we really have to double the efforts. And obviously, really all of the advocacy at the global level are really important. But tomorrow we are going to negotiate, to have some negotiation with some of our partners, to go to treat patients in hospital in Kinshasa. So
Tieno Baldé, we're going to leave it there because unfortunately time is against us. But I want to say thanks to all our guests, Tieno Baldé, Mocha Kamalyani and Azzedine Ibrahimi. And of course, thanks to you too for watching. You can see the program again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Rob Matheson, and the entire team here, goodbye for now.